323. For cardiac tumors, the most cardiac tumor is metastasis. So, metastatic tumors to the cardiac muscle are much more common than the primary tumors. For example, metastasis from melanoma and I guess lymphoma as well causes some metastasis to the cardiac tumors. So we have the myxoma. Myxoma is the most primary cardiac tumor. So if we are having a primary cardiac tumor, and that is not so common, but the most common parts of the primary cardiac tumors are the myxomas. They are in adults, of course, like the most common cardiac tumors in adults, not a child. It's the arrow in A, so it looks like kind of ball over here in the left atrium, and it 90% occurs in the atria, mostly the left atrium, as we see over here. Myxomas are usually described as ball valve. Well, it looks like a ball, and if you think about it, then it's obstructing some outflow or inflow probably inlet. So that's why it's considered a valve. So it's a ball valve. It's a ball valve obstruction in the left atrium associated with multiple syncopal episodes. Because if we are obstructing the outflow, then it makes sense to have syncope. Interleukin 6 production by the tumor. So the interleukin 6, we know that it causes constitutional symptoms just like fever and weight loss. So myxomas end up having fevers and weight loss. May auscultate when we could hear in early diastole, the start of the diastole, there is the tumor plop sound, and it mimics, sounds like the mitral stenosis. The murmur and symptoms worsen in upright position if the patient is sitting upright or probably standing, but it doesn't make a difference actually. They need to be upright position. Improves when lying down. Yeah, so we hear it better for the murmur and the symptoms as well. When the patient is lying down. Yeah, makes sense because it says murmur and symptoms they worsen in the upright position and improve when lying down. For the histology, there is gelatinous material, and the myxoma cells are immersed in the glycosaminoglycans. They are immersed in the glycosaminoglycans. The adults make six mixed drinks. That's just for memorization. And that's it for myxomas. For rhabdomyomas, it's the most frequent primary cardiac tumor in children. So this one, both of these, the myxoma is a primary, the rhabdomyoma is primary, but the myxoma is the most common in adults, while the rhabdomyoma is the most common in children. It is associated with the tuberous sclerosis. For the histology, it shows hamartomatous growth and more common in the ventricles. It happens in the ventricles more than it is in the atria. For the Cosmo sign, it's a paradoxical rise in the JVP, jugular venous pressure, on inspiration. So this is the most important part because normally the JVP would go down. The pressure of the jugular venous is just goes down on inspiration. So under normal conditions over here, on inspiration there is negative intrathoracic pressure, so there is it's easier for the blood to return and go back to the right side of the heart, so there's increased venous return. And because there's increased venous return, that means the JVP that is attached to it, the jugular vein that is attached to it, so this is the right atrium, right well, that's left atrium, this is right ventricle, this is left ventricle, and attached to the right atrium there is inferior vena cava, and then there is superior vena cava, and the superior vena cava is attached to the JVP. So on inspiration there is decrease in the intrathoracic pressure, so more blood can go back to the right atrium, which means the blood from the upper side of the body as well is going into the right atrium. So the JVP over here, of course, has a lower pressure. That's in normal conditions. But what is happening in the Cosmal sign, there is actually, during inspiration, there's actually an increase in the JVP. So what is happening is there is an impaired filling of the right ventricle, over here. So there's an impaired filling of the right ventricle that is leading to right ventricle cannot accommodate to increase venous return during inspiration. So because the blood doesn't flow easily into the right ventricle over here, so this right ventricle cannot or is unable to accommodate and be flexible with all the blood flowing in because there's increased venous return to it. So what is happening is that blood backs up into the vena cava because this right ventricle is unable to take up all the blood in a good way, in a good manner. Then the blood will back up into the right atrium, and of course from the right atrium it will also back up into the superior vena cava and ending showing as pulsation on the skin is increase in the JVP, and that is of course abnormal. So this is the Cosmo sign. This may be seen with constrictive pericarditis or restrictive cardiomyopathy, right heart failure, and massive pulmonary embolism, and right atrial or ventricular tumor. And it makes sense because if we're having some problem, let me delete this. Yeah, there you go. So, if we are having a problem with the whole right ventricle as heart failure, right heart failure, or if we have some constrictive pericarditis, so over here there is some kind of constriction, and also if we're having cardiomyopathy, all of that is just pushing on the right ventricle, preventing the right ventricle from being able to accommodate to all of the blood that is flowing into it during inspiration, because we said that during inspiration there is a lot of blood coming to the right atrium because intrathoracic pressure is decreased during inspiration. So because the blood is not coming is not being able to be received in the right ventricle, blood of course backs up upwards into the JVP. So these conditions include constructive pericarditis where the right ventricles and the other ventricle just cannot have enough space to um, get larger. And also there's restrictive cardiomyopathy, there's right heart failure and massive pulmonary embolism with right atrial or ventricular tumors. So for the hereditary hemorrhagic telangiectasia, it's also called Osler-Weber-Rendu syndrome. So it is an autosomal dominant disorder. This is the mode of inheritance, and of course of blood vessel. So it's an issue with the blood vessels, not with the myocardium or the heart at all. The findings include blanching lesions, these are called telangiectasias, on skin and the mucous membranes. And of course, recurrent abstaxes because we're having a problem with the blood vessels over here. And then there is arteriovenous malformations, yes, arteriovenous malformations like in the brain, lung, liver, and GI bleeding and hematuria, because it's all a problem within the blood vessels. And we see blanching lesions in the skin and mucous membranes, or recurrent abscesses, or arteriovenous malformations like in the brain, lung, liver, and GI bleeding with hematuria. And that's it for the hereditary hemorrhagic telangiectasia.